Hey everyone, let's talk a little bit about Penthrox. You may know this also to be called Metoxiflurano. Now when you guys get to the clinical workshops, you will become familiar with Penthrox as you will be using it to treat patients who present with acute or chronic pain. Now for those of you who have never heard of it, never seen it, or don't know anything about it, Penthrox is an anesthetic gas type drug. So it comes from a very similar family, and it produces anesthesia in your patients at high doses. So as you can see on this image here, methoxyflurane, just remembering that every drug has at least 3 different names. On here you can see at least 2. You can see methoxyflurane and you can see Penthrox. Either of these are okay. It doesn't matter whether you call it Penthrox or methoxyflurane. They both refer to exactly the same drug. So as you can see, this is the drug here in this vial. So it's a 3 milliliter, so a milliliters is a volume. So 3 milliliters of methoxyflurane. You've got the inhaler itself. And inside is a certain type of a wick that allows the drug to be converted into a special inhalation substance. And then of course you've got the activated carbon filter, which allows any methoxyflurane that's evaporated into the environment to be filtered to try and keep those responders who are using it safe. So the carbon filter is an addition to the device itself to try and protect the responders from inhaling the gas. And in fact, what you'll notice in most ambulance service guidelines is it tells the responders that they can only use this with their patients on 2 separate occasions within any shift for that exact reason. Now the dilution hole is designed to give patients a much more concentrated dose if they feel they need it. So let's go through together how we use it. Now number 1, you recognize that the patient's in pain. You can use methoxyflurane to not necessarily completely get rid of pain, but to numb the pain and to reduce it to the lowest threshold possible. And it's generally speaking very safe if you keep it within a certain dosage and therapy, which we're not going to cover in this lecture. So when you've identified that, you need to take the methoxyflurane, open the cap, do all the safety checks that you would do, ask your crewmate, what's that? Check it against your guidelines, indications, contraindications, make sure the seal's not damaged, all those usual routine things. Pour the drug into the top end of the inhaler, get your patient in the most comfortable position, and then ask them to intake nice deep breaths. Now it takes about 6 to 10 strong inhalations before your patient can actually start to feel the effects of the drug. And then of course, you can tell the patient to put their finger over the top of the carbonated filter if they need stronger doses. So that's just a micro lecture on methoxyflurane. I hope it's been useful for you, and please make sure you take a look at your simulated guidelines for the indications and the contraindications. And if you're looking to understand why the indications and contraindications are what they are, you can find plenty of information on the website. Cheers guys, take care.